Welcome everyone. Thank you for joining us today. I'm Theresa Marentette, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. First of all, as the CEO, I want to assure you that your local public health unit is working hard to protect you and your family during this pandemic. Our priority remains the health and well-being of the residents of Windsor and Essex County. Overall, 9,027 individuals have been tested for COVID-19. Currently, we have 1,343 tests that are pending. For those of you who are awaiting test results for COVID-19, please check the Ministry of Health's online portal or the link on our website. Please remember that while you await your results, you must remain in self-isolation. Before I share the case counts, I want to make you aware that our website, we're having a few difficulties, so the numbers may not be as up-to-date as what I'm reporting. There are 62,046 confirmed cases of COVID-19 in Canada, and 18,310 cases are in Ontario. Chatham-Kent has 89 cases, and Sarnia-Lambton has reported 192 cases. Michigan, I don't have the right number for Michigan, but we do have 9,424 cases in Detroit. Today we are reporting 665 cases of COVID-19 in our community, an increase of 9 cases from yesterday. 41% of our cases have occurred in long-term care homes, including both residents and staff. 229 cases have resolved. 15 people are in the hospital. 16% of our cases are between the ages of 20 and 29, 15% are between the ages of 50 and 59, and 21% of our cases are 80 years and older. 41% are male, 58% are female, and 1% is unknown at this time. Our community has lost a total of 57 people to COVID-19. 43 deaths have occurred among residents in long-term care and retirement homes. Our health unit is working with 10 long-term care and retirement homes that are currently experiencing COVID-19 outbreaks. I would like to once again thank EMS and our healthcare partners who have assisted us in completing 73% of mass testing in our long-term care homes. Testing for COVID-19 is based on a clinical assessment. Common symptoms include fever, a new or worsening cough, and shortness of breath. However, other symptoms may be present, such as a sore throat, unexplained fatigue, an increase in falls, nausea, vomiting, chills, headaches. If you are feeling unwell and need to seek a health assessment of COVID-19, there are several options. Complete the online self-assessment tool available at ontario.ca, contact Telehealth Ontario, or call your primary care provider for a phone or virtual assessment. To access a local healthcare provider, walk-in clinic, or virtual medical assessment, please visit ehealthwindsoressex.ca. We have 2 COVID-19 assessment centers in our area, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. Please note that testing is available for people who have symptoms of COVID-19. Please continue to visit our website at WECHU.org when it's up and running for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. We regret to inform the loss of 2 more community members due to COVID in our community. A male in his 80s, a female in her 90s, both resident of long-term care home, have lost their battle to COVID-19 in our region. I express my condolences and sympathies for the family, and our thoughts, our prayers are with the family. We're also reporting 2 additional COVID-19 outbreak in the long-term care facilities. One is Chartwell, Oak Park, LaSalle. The other one is Berkshire. The WECHU has remained committed to protect and promote the health and well-being of the residents of Windsor and Essex County. Long-term care home and retirement homes are considered high-risk settings due to the vulnerable population they serve, both in age and pre-existing medical conditions. Locally, we worked with Essex Windsor EMS initially and then engaged all the 3 local hospitals to support these long-term care home and retirement home with personal protective equipment, education, testing, staffing, and in some cases transporting residents for care in the field hospital that require more significant monitoring and care. With the assistance of Essex Windsor EMS, the Windsor-Essex County Health Unit began testing in long-term care home and retirement homes around Easter weekend. Prior to that, homes conducted their own swabbing of symptomatic residents on site. Beginning with the facilities in outbreak, Essex Windsor EMS and Windsor-Essex County Health Unit nurse practitioner have worked tirelessly to test staff and residents. Despite an inconsistent supply of swabs for COVID-19 testing, the mass swabbing of all the residents in long-term care home are still ongoing. I want to assure the community that despite all these challenges, we are on track to complete the mass swabbing in a timely manner. We are grateful to our healthcare partners for their unwavering commitment and support. Working with Essex Windsor EMS for on-site testing has been a seamless and welcome collaborative, and we will continue to do that until we finish all these long-term care homes and retirement homes. Thank you.
This is now unmuted.
We'll now take questions from the media. We'll start with AM 800.
Yes. Dr. Ahmed, do you have any theories in terms of how this virus is getting into long-term care homes? I think this is the most outbreaks we've had since this started at 10.
So we know even these 2 outbreaks that we just declared, it's in staff, and that's the working hypothesis that even right now, 1 case either in a staff or a resident. If it's confirmed, it is declared an outbreak. So we're working with the facility to make sure that the staff who is positive is off work, and the people he worked with, they are put in isolation, and all the appropriate measures are happening to prevent the spread in other members of the long-term care home and retirement homes.
So is this due to a lack of personal protective equipment? Because I understand that those staff are supposed to be taking extra precautions not to bring the virus into a home.
So when they are at the home, they are doing the universal masking. That's the direction that is very clear to all of them. And when they are working in the facility, they have to follow the appropriate infection prevention and control measures to ensure that even if they become symptomatic, they are not caring for the patient without having appropriate personal protective equipment on. So all those measures are in place, and we're hoping that it stayed and it didn't result in any further transmission.
Thank you.
Any questions from Windsorites?
Yes. What's the average time for receiving test results right now?
So we're looking for, on an average, 6 to 7 days. Some individuals are prioritized at the lab based on the need. For example, if someone is in the inpatient setting or if someone is in ICU, someone who's a healthcare worker, typically those test results are prioritized if it's appropriately identified in the lab requisition. When the lab sees those requisitions, they are identified and put it in as a priority list compared to someone who may have milder symptoms, and but the lab is working hard to get those results back to us in a timely manner. But those pending test results are continuing to add on to the list as we can see.
So a few weeks ago, the turnaround time for test results was 24 to 48 hours. What changed between now?
I think 48 hours is the timeline when it goes to the lab. I think there are other pieces of the puzzle that goes into it, and the second piece is the number of tests that these labs are getting. Some of the other challenges include the lab capacity to handle that specimen in a timely manner. Every lab has certain capacity, and if the lab exceeds their capacity, they have to send this specimen to another lab to get tested. And the logistic of all these supplies going to a central site and then further redistribution, it also takes time. And when it gets to the lab, then the turnaround time can be considered as like 24 to 48 hours that they can do it. But the specimen has to get to the lab in the first place as well.
Any questions from the Windsor Star?
Yes. Have any more long-term care homes moved residents to the field hospital?
And not that we are aware of. I think it's only just one facility that I'm aware of that has transferred a number of residents to field hospital.
It appears since the new outbreaks at these homes, it's one staff member each. So are those staff members, can you trace that to community spread?
Well, that's the understanding. Those detailed interviews are happening, and we'll get more details. But the assumption is they acquired it out when they were in the community.
So just for clarity, that would be a time when they're not necessarily wearing fully equipped PPE and the things that are protecting them in long-term care and protecting residents.
That is correct.
Any questions from CBC?
Yes, good morning. I see there are about 600 new tests done yesterday. Was that another sweep of long-term care and retirement homes?
So every day we are doing a number of long-term care home and retirement home. Even today we are planned to do another 450 tests in long-term care home and retirement home. All our partners, including our staff and EMS in particular, we have been working tirelessly to get all these long-term care home and retirement home tested in a timely manner. So we'll continue to see those numbers until we complete mass testing in all these facilities.
And Premier Doug Ford was talking about the Ontario Medical Officers of Health yesterday, blaming them for inconsistencies on COVID-19 monitoring and the lack of testing. Do you have anything to say about basically what he's calling a lack of testing on residents?
So my focus is right now dealing with the COVID-19 pandemic, and my priority is to serve the needs of my community, everyone who lives in Windsor and Essex County, and we have been doing this diligently since it all started back in January, and we'll continue to do that. So my focus is on serving the needs of the community, and I would like to keep that focus going on.
When we had a large burst, I think it was more than a week ago. Should we expect there to be more resolved cases coming up? Because there still seems to be quite a bit of people in flux right now, still either self-isolating with symptoms or I guess really not in hospital or ICU. I think those numbers are pretty low. But should we expect to see more resolved cases soon?
Absolutely, and I think it all depends on the day or when they started their symptoms or the day when they were tested. So all those cases, we like to get them under the resolved category as soon as possible if they meet the criteria. So in order to meet the criteria, a person has to be asymptomatic and at least 14 days from the onset of their symptoms. And if it exceeds the 14 days, then we're looking for symptom resolution for at least 48 hours. So whichever is the longer, that's what we considered as symptoms or case resolved.
Would there be a time where you would write active cases as opposed to just resolved, those who have died, so that we would know exactly how many active cases there are every day?
That's a good consideration. I can take it back and see if there's a way to report that.
Thank you.
Any questions from Blackburn?
Yeah, just going back to the testing, you said, like talking about lab capacity, it's actually is the problem getting the tests to the lab? Is that where the delay is happening? Or, because you're talking, sorry, kind of a little bit confusing. If you can just clarify that and say where exactly is the delay?
So what I was responding to is the turnaround time, but if you're just trying to look at how the entire process unfolds, so in order for us to test a home, there are a number of things that needs to happen in the first place. So first and foremost is the availability of the swabs. We have to have swabs on hand to go and test in any facility. before we go into the doing mass testing in those facilities, we need to give some advance notice to the homes that there will be people coming in to do all this testing in a short period of time to ensure that all the residents and staff that are on duty, they can be tested in a timely manner. So before we go there, we need that list, we need that number. We need that number to ensure that we have the swabs. We need that list to make sure that we have the appropriate lab requisition for each of the resident and staff. Every person needs a requisition, and every staff member also needs a requisition. Once we have the lab requisitions, we also need to have appropriate labels. So labels need to be created, printed, and taken with us to that facility when we are going there. In the facility, we need staffing to make sure that there is a good flow of people who are coming in, getting tested, and then moved back to their own rooms or to their own beds. And the flow of the patient, the coordination, that also need to happen. Taking just the swab, it's just one process. Once the swab is taken, it needs to go back to its container. An appropriate label has to be attached. Appropriate lab requisition has to be attached. It needs to put into a specific bag for the transportation. Any breakage in having a wrong requisition, a wrong label, or inappropriately putting the swabs in a bag could result in a failure of the testing, which we don't want. We want to make sure that all these processes are happening. Once it's all done, then all these specimens need to go to at the assessment center or through a courier service to the lab. And then when it gets to the lab needs to look at the capacity, whether they're able to test the specimen within the 72 hours of the time that it was tested. If it's taking more than 72 hours, they need to put into some kind of a refrigeration to ensure that the specimen doesn't get bad. And having said that, if the lab do not have the capacity, they have to ship it out to another lab. And then ensuring that all these specimens are tracked. We do not want any of those specimens to go missing. The tracking system, and then when it's going to the lab, ensuring that the lab have a good inventory and tracking system to not only for themselves, but a process to report back to the public health. And when we are getting the results back, there has to be a mechanism to identify that all these labels, all these individuals can be appropriately linked to a facility. Because if we are getting those results independently, like on its own, it would be hard to connect them with the outbreak and to link them with the facility. So there are a lot of moving parts to the puzzle rather than just going into any home and do the swabbing. So far, the entire process has been very well coordinated, working with the EMS. They're an amazing partner to work with. All the hospital partners, they are also providing their staff to go into those homes to ensure that we are completing all this testing in a timely manner. But as a result, now we are testing more. What we are seeing is more pending results that is continuing to rise. And so it's an overall, the entire system that is adapting to the needs of COVID-19 pandemic. And we are trying to fix the system as we are still using the system. So it's not as simple as why can't we just test the results, get the results back. There's a lot of work that goes on the background before we get to that point.
Have you talked with other hospitals or health units and other health units experiencing the same delays, or is it
Because we don't have a lab here that we're experiencing some of these delays?
Some of my colleagues are having the same challenges. The biggest challenge that we have always had is the lack of availability of swabs in a timely manner. If I don't have the swabs in my hand right now, it's very difficult for me to even say that tomorrow to one facility that we're coming to your facility when I don't even have the swabs in my hand. So there has been some progress to it. But there's still some significant challenges to this delivery of the swabs, and also to get all these long-term care homes on board in a short period of time to make sure that they have everything ready. As I mentioned, there are a number of other things that need to be in place before we go to those homes. So there are all kind of logistical things that need to happen. And most of my colleagues are experiencing exactly the same issues.
Any questions from CTV?
Well, just to preface the question, how many medical offices are there in Ontario, roughly?
So there are 30 health units. So every health unit has at least one medical officer of health, and some have the larger health units. They have associate medical officers of health as well.
Okay, so having said that, so you have Doug Ford as the teacher, let's say, in this scenario, and he's picking on all the students, and he's schooling them, and he's calling them out, telling them you got to pull the socks up. Do you feel like you're one of those? Do you take that personally when he's attacking, the class?
So what I said is I have a pandemic to deal with, and I'm focused on that. I have my community that I am responsible for, and my focus is to focus on what needs to be done, and we want to just keep our focus and attention to the thing that matters to the community, for the safety and well-being of our community. So I like to focus on that part.
I know we're all, my saying is that we're all victims of the system at some point, down the road at some point. So with 1,300 pending tests, how do we rank in the province in terms of?
Honestly, I don't have any idea that how many pending tests are in other region, but for me, it's pretty significant because at one point we brought it down to 150 pending results, which was, I guess, happened for one day only, and then now we are back to that spot. As a clinician in me, I want those results back in as soon as possible, either within 24 hours or within 48 hours max, recognizing that there will be some systemic delay because we work in a publicly funded system, and there are some issues with that too. Until we get to the point of having those test results back, either having a lab that is local with the capacity to process the sample within 24 hours, that would be great. Or we get to a new type of testing which is validated and approved that can provide us with the results. Even with some of the newly approved quick test, we heard from Health Canada that they're looking into it, and it may not be as it failed the validation criteria. So I think we have to be careful as much as we want those results to be coming back to us in a timely manner. We also need to recognize what current technology and lab capacity exist. So 1,300 tests is definitely something that we are concerned about, and we like to see those numbers go down quite significantly for our community.
So when all of this is said and done, if it ever gets all said and done, we all learned something in the process. Will you make a recommendation to the province at some point to say, hey, you took our lab away, maybe it's a good idea that we have one. If we don't have one, maybe we can have a makeshift, a plan to have a makeshift ready, just like the hospital did with the St. Clair College Infirmary. So, will you propose something like that after we're sort of out of the woods?
So usually any type of, after any pandemic or any major health crisis, we do see some learnings that comes out of it. Even with SARS, there was a commission that prepared a report with several recommendations, including recommendations for public health and how public health should operate in this province. So there are a number of recommendations there. I'm sure when this is all said and done, there will be further recommendations which include looking at these type of availability of labs locally to support that. And I think from a local perspective, Windsor is a big enough city in the region, Windsor and Essex, that we should have something. But it would be up to the hospitals and I think to the lab facilities that are able to set up those services, and what does it take for them to have those type of facilities. I think that's another question too. So they need to work on it and make sure that those voices are heard appropriately.
Any further questions from AM 800?
I just wanted to clarify. So there's about 600 tests being taken a day, and how many of those are in long-term care homes?
I can say the majority of them would be at the long-term care homes, and typically our assessment center do roughly 80 to 100 at the Windsor site. I'm not 100% sure about how much testing that they're doing at Erie Shores, but my guess it would be similar. So we can take off maybe between 150 to 200 testing at the assessment center, and the rest at all the long-term care homes and retirement homes.
Okay, so you said earlier about 450 at long-term care homes. That's fair to say.
That's for today. That's planned.
Okay, thank you.
Any further questions from Windsorite?
No, thanks.
Windsor Star?
Yes, Doctor, I'm just wondering if there are any significant bureaucratic barriers or other hurdles in your way stopping you from doing things that you would like to be doing right now to solve issues in the community to help people through this pandemic.
So there are obviously there are a lot of players, there are a lot of partners, there are a lot of lessons that we are learning, and the system as it exists right now, it doesn't facilitate this kind of collaboration. What I can say is, from a public health perspective, before since COVID started, our work has been doubled before the COVID happened to us, compared to if you're looking at the entire other healthcare system partners. The work may have gone down if we haven't reached a surge and we didn't get what the expectation was. So even then, when we are looking at how much work public health is doing, which is essentially nonstop for more than 2 months, every day, Saturdays, Sundays, 10 to 12 hours every day, it's a significant amount of time and effort and expertise. So as much as the partners and others and the system is willing to provide that support, but that level of expertise may not even exist there. So I think it was a challenge, but we are getting there. We have got now good partnerships happening. People are realizing the importance and the expertise of public health. And as we continue to move forward, I'm sure that we will have a better system which makes it easier for us to work together in a way which is helpful for the community. Because at the end of the day, it's all the community that we are serving. What my goal is, what my role is to make sure that I am doing my job of protecting and promoting the health and well-being of our residents of Windsor and Essex, and we'll continue to do that.
Thank you.
Any further questions from CBC?
Yes, I was wondering, do you have a number of the swabs reserves that we have? Do we have 1,000 tests available? Do you have a number?
No, the supply of swabs is very inconsistent. Some days we are getting 1,000 swab and then we don't get any for a number of days. Some days we are getting hundreds of swabs and then nothing for some days. I think that's been the real issue. Even for the planning, we cannot plan for something if we don't even know what to expect. As I said, it is getting better, but I think still there's work that needs to happen.
Thank you.
Any questions from Blackbird?
No, thank you.
CTV? Thank you, everyone.
Thank you.
Thank you.